Hi, I'm Dr. Wesley Shankland, and welcome back to our YouTube video programs. I'm going to talk today about an interesting disorder that few physicians and dentists even recognize, yet it's been around for a long time. It's called hamular process bursitis. Now, I've treated patients with this problem for many, many years, but I always wondered what the problem really was anatomically. So when I went back to graduate school to get my master's and my PhD in anatomy, one of the things I wanted to do is try to determine what the problem might be. So I taught gross anatomy to medical students at Ohio State, and when they would be finished with the cadavers and they would leave, I would stay in the laboratory and I did numerous dissections on cadavers on areas that the students didn't give a darn about, but I did. And let me talk to you about some of these symptoms. If you've ever had problems with your throat, for example, your upper part of your throat where you had soreness and pain radiation maybe up into your ear, your TM joint, down your throat, into the roof of your mouth, especially if you swallowed, that could be hamular process bursitis. Some people also have discomfort if they wear a denture and they place a denture in their mouth and the denture extends posteriorly on the soft palate into an area we call the vibrating line. That can also produce hamular process bursitis. But what do I mean by that? Well, a bursa is a sac-like structure around a joint, such as the knee. You have a bursa in the knee, you have a bursa in the shoulder, in the elbow. A bursa is a structure in which synovial fluid is produced to give motion and smoothness to the joint. But if you have a bursitis, you have an inflammatory process of that synovial fluid, which is painful, it swells, and causes dysfunction and lack of mobility of the joint. Now, if that's in your throat, then you can't swallow well, you can't speak well, you have radiation of pain into your throat, to your ear, your TM joint. And people go through many, many diagnostic procedures, and yet they don't find the problem. Most people are misdiagnosed, and nobody can find a problem because you can't see it. And this little process I'm going to show you in a moment here is very difficult to see on a radiograph. So what am I talking about here? Well, let's look at this skull. This skull demonstrates a bone right here called the sphenoid bone. This sphenoid bone, I'll take this lower jaw, the mandible off. This sphenoid bone right here has the lateral and medial pterygoid plates, and on these plates is this little hamular process. This is a portion of the skull here that is intimately involved with your pituitary gland and vascular supply to the brain in that area. But this pituitary gland and this hamular process are all right here from the sphenoid bone, and that's the center portion of your skull. Now, if you look at a better picture, this is what it looks like here. I take the skull away and just show you the sphenoid bone. The sphenoid bone has these lateral and medial pterygoid plates on the bone itself, and this little structure right here is called the hamular process. It's like a little hook, and around that hook goes a muscle called the tensor fili palatini muscle. And when you swallow, that tenses the soft palate so that food and liquids don't come out of your nose when you swallow. You know, when you're a teenager and you're having fun and you're laughing, you might be drinking pop, and somebody is laughing, they may have liquids come out of their nose. Well, that's because the hamular process was tensed and the tensor fili palatini muscle didn't close off that nasal pharynx really well. So if you have pain right here on this little hamular process, the hamular process refers pain, like I said, to the ear, to the TM joint, to the throat, especially when you swallow. This little structure right here, this hamular process, around which travels the tensor fili palatini muscle, tenses and causes pain, just like a Charlie horse in your throat instead of your leg. I'm going to show you some PowerPoint presentation of this, and you'll see even more clearly what I'm talking about. In treating hamular process bursitis, it's rather simple, but yet it's complicated. You can see from this dry skull, you can see this structure right here called the lateral pterygoid plate of the sphenoid bone. Here's the medial pterygoid plate, and this is called the hamular process, the pterygoid hamulus off the medial pterygoid plate. That's the little fulcrum that the tensor fili palatini muscle winds around to tense your palate so when you swallow, liquids or solids, they don't come out of your nose. And this is a drawing that my son David did of the sphenoid bone And there's a pterygoid hamulus right here. This is called a suture, a little suture which provides movement between the sphenoid bone and the pterygoid hamulus as this muscle, the tensor fili palatini, wraps around this to close off the nose, and there's movement there. In the body, we have to have a suture to provide movement. And here's what it looks like again. Here is a nice picture of an x-ray of the pterygoid hamulus of the sphenoid bone, which is rather rare because it's hard to find one that good. But that's the bony structure you look at. And the symptoms would be pain in the soft palate area, pain in this area called the pterygoid hamulus on the soft palate, throat pain on the same side as this is occurring here, pain with swallowing right down the throat. You'd think you have a tonsillitis or some kind of a sore throat or a strep throat, and pain in the same side of your ear, the same ear. The diagnosis of this is made by history, and oftentimes there's trauma to the mouth. There's hitting this thing perhaps with a toothbrush. I had a patient do that one time. I even had a denture for lots of patients have an extended denture that push against this pterygoid hamulus in the soft palate. So there's history, palpation of this structure in the soft palate, and I'll show you a picture here in a moment. And lastly, a successful anesthetic injection. Now here's what the pterygoid hamulus looks like below the soft tissue of the soft palate. Looks like this right here. And what I do is I give an injection with a small needle right here after applying a topical anesthetic, a small needle, and right here give a better injection. In that injection, I'm giving a local anesthetic to numb the area up. If the pain subsides or goes away, that's pretty much diagnostic for hamular process bursitis. How do you treat this problem? Well, there are major ways conservatively. We treat it by taking the irritation off of the area, such as a denture. We put them on NSAIDs such as ibuprofen. We also give an injection of Marcaine, which is a long-lasting anesthetic with an anti-inflammatory medication. There are various kinds. And also we have people eat a soft diet. Surgically, we've devised a procedure where we actually remove this little bursa, this little sleeve that goes around the pterygoid hamulus, which lubricates the movement of the muscle, or we sometimes have to remove this pterygoid hamulus itself anatomically. Now that you've seen the hamular process bursitis and anatomically what we're dealing with, how do you treat this disorder? Well, there are a couple of ways we treat it. The first and most common, most successful way to treat this is doing an anesthetic and cortisone type of injection into the bursa around this hamular process of the sphenoid bone. Just like your physician would give you an injection into your shoulder or your elbow. If you had a tennis elbow, for example, it's the same thing. It's a tennis elbow of the throat. And we give a little special anesthetic in that region with some cortisone and then place you on some oral cortisone, and that usually takes care of the problem. Sometimes we have to do it 2 or 3 times. If that doesn't work, we've perfected a surgical procedure that we surgically go in and remove that off the base of the skull, and that usually takes care of the problem. But how did I get used to this, or how did I get interested in this hamular process bursitis? We're in Ohio, and there's a state above us, which we in Ohio don't say too often, Michigan. And that state has a upper peninsula, a big portion, way, way, way above there, 8 or 10 or 12 hours from Columbus. It's a long distance. And I had a man come down to my office one time, and he walked into my office, and he brought a bag of dentures. Now, that's a bad thing for a dentist to see, somebody come in with a lot of dentures. Very nice man. He said, "Doc, I've had problems with my upper jaw. I've had pain since I was probably 21 or 20 years of age. And I only wear my denture when I go to church or if I go out to dinner because it hurts so much." And I asked him to show me. So he put the dentures in. They looked great. His dentist was a good dentist. But the problem was the denture just caused pain by sitting in the mouth. So like I said earlier in the video, sometimes people who don't have teeth, who wear an upper denture, if the denture is placed in their mouth, this pain begins. Well, what happened was this compressed this hamular process and the tensor fili palatini muscle, causing the tendonitis to exacerbate, to form symptoms, and he couldn't wear it. And he said from the time he's 21 or 22 years of age, he kept going to dentists, and they kept removing teeth, thinking that would be the problem, and yet it never was. It always came back. So I looked at him, examined him. I saw where the problem might be, so I gave him a little diagnostic injection. I left the room, and I came back after seeing somebody else in about 5 or 7 minutes, and the guy was weeping. I thought, oh my Lord, what have I done to this guy? Well, nothing. He said, Doc, look at this. He puts his denture in his mouth. There was no pain whatsoever. I had numbed up this Hamular process, the bursa that goes around the Hamular process, and his pain was eliminated. So I treated him therapeutically. It was on both sides. I treated him with a local anesthetic, Marcaine, and a cortisone, Celestone Soluspan in the area. And he was staying in Columbus because he had to drive about 12 miles to come and see me. So I saw him the next day. And he came in and tears just came down out of his eyes. He had no pain whatsoever for the first time in about 30 years. So that's how I got interested in this. I wondered what in the world was going on. So when I went back to graduate school, my professor, Dr. John Negulesco, was a wonderful, wonderful man. Let me kind of fool around and do things that normally I wouldn't do, but he let me go off the beaten path because I already was a dentist. So he already let me have some leeway. And I did the sections, and I was able to prove there was a bursa back there. We did a study. We did a paper that was published internationally that demonstrated there was a bursa around this Hamular process. So Hamular process bursitis can produce throat pain, pain in the ear, pain in the TM joint, pain especially when you swallow, and that pain is there, makes it very difficult to wear any kind of denture or eat any large boluses of food. So if you have a problem like this, contact your dentist or especially an oral surgeon and talk with them about this problem. If you have to ask questions, contact my office. I'll be glad to help you. And perhaps we can get you taken care of and take care of this problem for you. Hamular process bursitis. Thank you very much. Thank you for watching this video. If you have any questions or comments, put them down below. I read all your questions, all the comments. I try to answer all the questions, suggest topics for videos in the future, and I'll try to address them. Thank you for watching.